Hi, Miss Jilla. How are you doing today?
I'm good.
Good. My name's Brianna, and I'll be your nurse. I'll be performing your assessment. I'm just going to make sure I have my proper equipment. So I have my stethoscope and my pen light, and I also have my gloves and hand sanitizer for proper hygiene. So, are you using any assistive devices?
No.
Nope. And are you having any pain?
No pain.
So on a scale from 0 to 10, you would say you're probably a 0?
Yep.
Okay, awesome. I'm going to ensure that we're in a safe and private environment. We are. Can you say your full name for me?
Lauren Jilla.
And the date?
It's Sunday.
And where are we?
We are at my house. Sorry.
Okay, so patient is alert and oriented ×3. She has clear speech and she's able to respond to questions. I'm going to give you 3 words for you to repeat for me at the end of the assessment.
Okay.
The words are chocolate, coffee, and dog.
Okay.
And I'm going to have you smile and frown and puff your cheeks and raise your eyebrows. Okay, awesome. Patient's facial cranial nerves are intact. I'm going to have you place your fingers to your thumbs on each hand. Awesome. So her fine motor skills are intact. And I'm going to have you close your eyes, and I'm going to touch 5 different spots on your body. And just tell me where they are.
Okay. Right foot. Left knee. Right shoulder. Left hand. And nose.
Okay, awesome. So patient is able to respond to sensations when I touch her body and tell me where they are. So her sensation is intact. Now I'm going to have you stand up, and I'm going to have you walk to the door and back to me. Awesome. So patient is able to walk without swaying or tripping, so her gait is normal and her posture is erect. Now we're going to test your balance. So I'm going to have you stand on one foot and then switch to the other. Okay, so her balance and coordination is intact, but I'm going to have you do the Romberg test. So stick your hands out and close your eyes. Okay, awesome. So patient is able to stand with her eyes closed without falling to either side. So her balance and coordination is good and normal. So now we're going to assess the musculoskeletal system. So I'm going to have you spin around and lean over. I'm going to palpate the spine for any nodules or masses in the back, and I don't see any. I also don't see any rashes or lesions in the skin. You can turn back around for me. And now I'm going to assess your, there was also no abnormal spinal placement. So she does not have scoliosis, lordosis, or kyphosis. Now I'm going to have you stand this way, and I'm going to have you raise your arm and spin it in a circle. Is this painful at all?
No.
Okay, and there's no sign of crepitus. Now I'm going to have you bend your arm for me. Is there any pain?
No.
Okay, there's no crepitus. Then go ahead and spin your wrist. Is there any pain?
No.
There's no crepitus. Now we're going to do the same thing on this side. So I'm going to have you stick your arm out this way and rotate it. And is there any pain?
No.
There's no sign of crepitus. Now I'm going to have you bend your elbow. Tell me if there's any pain.
No.
No crepitus present. And last one, spin your wrist. Any pain?
No.
And there's no crepitus. Now we're going to assess your strength in your upper extremity. So if you could press up against my hand and press down. Good. And do the same thing on this side. So press up and down. So strength is equal bilaterally with 5 out of 5. And now I'm going to have you sit down and, I'll have you stand back up and we'll assess your lower extremities for range of motion. Okay, so if you could stick your leg out for me and then to the side. Is there any pain?
No.
No, and no signs of crepitus. I'm going to have you lift your leg up, bend your knee. Is there any pain?
No.
And there's no crepitus. And spin your ankle in a circle. Okay, any pain?
No.
No crepitus. Do the same thing on this side. Stick your leg forward and up to the side for me. Any pain?
No.
There's no crepitus present. Bend your knee for me. Pain?
No.
And no crepitus. And then spin your ankle in a circle. And there's no sign of crepitus. Is there any pain?
No. No pain.
Awesome. So there's no pain or crepitus in the lower extremities. So now I'm going to have you sit down and we'll assess your strength in the lower extremities. So if you could stick your leg out and then press up against my hands and then down. Awesome. And the same thing on this side. Press up and down. Okay, so there's the strength in the lower extremities is equal bilaterally and it's a 5 out of 5. I'm now going to assess your skin on your hands, on your arms. So pull it up for me, thank you. So her skin is dry and warm to the touch. There's no lesions or rashes present. I'm going to assess your capillary refill, which is under 3 seconds on both hands. There's no clubbing present, and the skin turgor is good. There's no tinting on either side of the extremities. Now we're going to do her lower extremities. Capillary refill is under 3 seconds on both sides. Tenting, there's no tenting present, so the skin turgor is good. No clubbing, and the skin is warm to the touch, and there's no lesions present. Now I'm going to assess your pulses. So I'm going to assess your radial pulses. Those are equal bilaterally, 2+ in strength. The dorsalis pedis pulse is equal bilaterally. There's no bounding. It's a 2+. Now I'm going to assess the tibialis, the posterior tibialis pulse, which they are equal bilaterally and 2+ in strength, no bounding. Okay, so now I'm going to assess your head and neck. So the head is midline and the neck is also midline. It's erect. I'm going to put my gloves on to assess the hair. So the head is also normal in size and shape and proportionate to the body. When I check for the scalp, there's no lesions present. There's no dandruff or critters on the scalp. There's no receding hairline, and the texture and color is healthy looking. So that's good. I'm going to go ahead and take these off. Sanitize my hands. Okay. There's also no signs of alopecia, so there's equal distribution on the head. Okay, so now I'm going to assess the neck. The trachea is midline, and I'm going to have you swallow for me. So the thyroid gland is not palpable, which means it's not enlarged. The lymph nodes are also not palpable, which means there's no sign of an infection. Now I'm going to palpate your sinuses. So let me know if there's any tenderness or pain when I press.
No.
No, good. So the maxillary and frontal sinuses are normal. There's no swelling or tenderness is reported by the patient. Now I'm going to assess your temporomandible joint. So I'm going to have you open and then close for me. Is this painful in any way?
No.
Okay, there's also no crepitus present. I'm going to assess your range of motion. So I'm going to have you bend your neck this way and then say, as if you're saying no, and then up and down as if you're saying yes. Okay, so patient's range of motion is intact and normal. Now I'm going to have you shrug your shoulders So patient is able to shrug her shoulders, so her accessory spinal nerves are intact. So that's good. I'm going to now assess your ears. Are you having any trouble hearing lately?
Nope.
Nope. Okay. And you're not using any devices for your ears? Okay, awesome. So I'm going to inspect. There's no lesions or rashes on the ears. And if I palpate, there's no nodules present in the ear. When I look with my pen light, there's no drainage or excessive earwax buildup in the ears. Now I'm going to perform a whisper test. So I'm going to whisper a word on either side of you and let me know if you hear it. Just repeat it back to me.
Okay.
Bus.
Pillow.
Okay, awesome. Patient is able to repeat the words back to me, so hearing is intact. And now we're going to assess your eyes. Are you having any trouble seeing from a distance or close up to you at all?
Nope.
Okay, awesome. So the sclera is white. There's no yellow presence, which would indicate jaundice, but that's good. The iris is a brown color and distributed evenly. The cornea is clear. Her conjunctiva is a nice pink color. It's moist, but there's no excessive drainage. Now, the pupils are about 4 millimeters, which is normal. I'm going to perform the 6 cardinal fields of gaze. So I'm going to have you follow my pen light.
Okay.
Okay. So patient is able to follow the pen light appropriately. So her muscles are intact. I'm going to have you follow my pen light again and follow it as I bring it to your nose.
Okay.
Back. So patient is able to accommodate when an object is in front of her. Now I'm going to see your pupillary restriction. So I'm going to have you. So I'm going to shine this light in your eye and see. So the pupils constrict consensually, which is normal and appropriate. Okay. Now I'm going to do the peripheral vision test. So let me know when you see my fingers wiggling.
Now.
Awesome. So patient is able to see objects around her normally. So now we're going to assess your nose. Are you having any trouble smelling?
Nope.
Lately? No? Okay. And now I'm going to assess your patency. So I'm going to have you plug one side of your nose and breathe out. And the other side and breathe out. Are you having any trouble with that?
Nope.
Okay. So there shouldn't be any obstructions in the nose. I'm going to look with my pen light. Okay, so I don't see any obstructions or lesions. The septum is not deviated, so breathing is normal for the patient. Skin is normal, and the size and shape of the nose are both normal. Now I'm going to assess your mouth. The lips of the mouth are pink, and they do not appear to be chapped in any way. I'm going to have you say, Okay, so her uvula is midline and tonsils are present but not enlarged. Are you having any trouble tasting?
No.
No? Okay. And hot and cold liquids or foods are any trouble?
No.
Taste? No?
No.
Okay. The gums, can you smile, are pink and normal. They're not inflamed in any way. The teeth are white, and there's no plaque buildup. The mucosal membranes are also moist and a pink color, which is a normal finding, so that's good. And there is no odor present in the mouth, which indicates that she does not have halitosis. Now I'm going to assess your pericardium, so I'm going to palpate first. I don't feel any flutters, and there's no barrel chest. And now I'm going to auscultate. And I'm going to auscultate for the S1 sound, fifth intercostal space mid-clavicular line. Good. And now I'm going to auscultate for the S2 sound, which is the second intercostal space. Okay, so all findings are normal, and now I'm going to palpate the carotid pulse on each side. So strength is 2+ bilaterally, which is normal. Now I'm going to auscultate the carotid pulse. So pulse is also normal bilaterally, and there's no sign of any bruits. Now I'm going to have you stand up for me, and we're going to assess the lungs. So I'm going to have you turn right around. I'm going to place my hands on you and have you take a nice deep breath. Awesome. So lung expansion is equal bilaterally and symmetrical. There's no barrel chest present. Now I'm going to auscultate on your back. So each time I place my stethoscope, I'm going to have you breathe in for me.
Okay.
Take a deep breath.
Okay.
Okay, awesome. So now I'm going to actually auscultate on the front side as well. So you can turn right around for me. Thank you. Take a nice breath in. Okay. Awesome. So patient does not have any trouble breathing, and lung sounds were appropriate and normal. If I could have you now lay down on the couch for me. I'm going to assess the abdomen. The color of the abdomen is consistent with the rest of her body. There's no lesions or rashes present. And now I'm going to auscultate. The 4 quadrants for vowel sounds. Okay, so I heard normal vowel sounds, which were swishing and popping noises in all 4 quadrants. There were also about 10 sounds per minute, which is normal finding, and I was also able to auscultate the aortic pulse, and it was normal. There was no sign of an aneurysm. Now I'm going to have you sit back up for me, and I'm going to ask you to repeat the 3 words that I gave you at the beginning of the assessment.
Coffee, chocolate, and dog.
Okay, awesome. So that completes my portion of the assessment. Do you have any questions for me?
No.